Good afternoon and welcome to this edition of Ask the Doctors on Whitewater Community Television's WGTV Channel 11. I'm Eric Marsh, Executive Director of WCTV. Glad you're able to join us for this program where our doctors they won't be answering your questions today. They'll be answering my questions today. Yeah, I like that. And they will also be having conversations with other doctors. Later on during this hour, we'll be talking with Wayne White, Dr. Wayne White, who is the Fayette County Health Officer, the kind of partner organization, as it were, or same job that you hold, so that should be interesting. One of our doctors, Dr. David Jetmore, who is Wayne County's health officer. Our other doctor, Dr. Thomas Huth, Reed Health. Gentlemen, thank you very much.
Our pleasure.
As we start every week, let's figure out what's new everything changes as the weeks go on with this. It seems like every week we learn something new. I think we started with Dr. Jetmore last week, so Dr. Huth, we'll turn to you this week. What's new?
Well, really the main topic of conversation is the increase in cases in the world, around the country. There are several states driving that, pretty much the same ones. But then there are increasing concerns in Ohio with increased cases, and a little bit of that in Indiana, particularly in certain areas of the state. And consequently, the governor has delayed some of the reopening in Indiana, which we can talk about more. I don't know all the details on that. There's a new initiative to try to encourage mask wearing that we might talk about a little bit. But from Reed's perspective, things continue to be well in hand. We really have not been seeing an increase in cases. Our numbers continue to trend downward. And I think this is the third or fourth day in a row where we've had 0 ventilator patients in the hospital with COVID ventilator patients. Yeah. And so we haven't had that really since the very beginning of the epidemic. So really, from our perspective, things are going very well in Wayne County, but I'm sure that Dr. Jetmore will feel that things could be better.
Well, I think when you look at the overall trend of where this is going, it's somewhat discouraging in that as we've lifted mitigation, we've seen cases go up. As Dr. Huth has said, I think 37 or 38 states have seen an increase in cases. I think it's hard to tell where exactly Indiana is. It's probably one of 12 or 13 states where we're kind of treading water, which in this climate is a good thing. There's a few states where we're seeing decline, but I think one of the things that we're wrestling with is the reluctance of people to wear masks. This has become such a hot button item, and it's one of the most important things that we can do, along with social distancing and hand hygiene, to stop the spread of the disease. We're fortunate here in Indiana in that we have not seen one of these rapid peaks that's going on in the West and in the South. And I think the governor has anticipated what's happened in these other states and is kind of trying to preempt that by prolonging the reopening by a couple weeks, basically prolonging stage 4, which largely has to do with the amount of people in restaurants and in bars. So I'm encouraged that we live here in Wayne County, where we haven't seen an upsurge in cases, but I'm discouraged by what's happening in our fellow states. I was talking to Eric beforehand, I'm reminded of the fervent resistance of motorcycle helmets that motorcycle riders have, and I ride a motorcycle myself. But if you don't wear a motorcycle helmet, the only person that's affected is yourself. Whereas when you don't wear a mask, you can affect a multitude of other people.
You're watching Ask the Doctors on Whitewater Community Television's WGTV Channel 11. We have Dr. Thomas Grayson holding on Zoom for us, and we're going to bring him into this conversation, a surgeon here in town. Dr. Grayson, are you with us?
Hello.
How are you today?
Good, good. You?
Doing well, thank you. Dr. Huth, I'm going to let you take over.
Tom, thanks for being here. Dr. Grayson, by way of a little bit further introduction, he's one of the senior surgeons in the Reed General Surgery Group, General Surgeons Incorporated. And he's a kind of an outspoken advocate for, trying to do the right thing with COVID, and he's a very engaging guy, as we'll learn in just a minute. So I thought it'd be fun to talk with him for a couple minutes, you and I, Dave, and about what is going on with COVID from his perspective. I think he has a little bit of a different experience with all this than probably Dr. Jetmore or I have, working kind of in the front lines directly with patients and dealing with all the consequences of, how do you take care of patients with COVID in the background. And I think the first thing I wanted to ask you, Tom, is how did COVID-19 affect your practice in the very beginning? What were the big changes that happened with you during the shutdown, and what were you doing during that time?
Sure. It's had a significant impact, as known. A surgeon like myself, and really the surgery in the hospitals, there's two parts. One are the scheduled operations, or what are sometimes called elective, and those you have a little more latitude of when the operations are done. And then the other component are the more urgent and emergent operations. The elective or scheduled cases, those, of course, when there was a lot of uncertainty about what the numbers were going to be, and essentially would hospitals be overwhelmed, of course, via the governor of the state, why elective surgery was stopped. And we stopped scheduling. We canceled patients who were already scheduled, which was obviously terribly disruptive to people, and felt bad with that. But I think that made sense from the standpoint of keeping the hospital capacity available if we ended up needing it and getting overrun essentially with COVID patients. The urgent and emergent patients, theoretically, they wouldn't have or shouldn't have changed, but we definitely saw patients who were trying to avoid coming out to the hospital even when they did have something that was more urgent or emergent. So those numbers dropped a little bit, but it also changed what we were seeing in the operating room. So it had a significant impact. In scheduled cases, that was intentional, but then the emergent and urgent cases, that was unexpected to see the change with that.
So one of the things that people became concerned about during the course of the pandemic has been people actually coming in to get their normal needs taken care of, and particularly for emergency needs. Like, for instance, I know that the emergency room doctors noticed that people were arriving late with stroke symptoms, maybe waiting too long and kind of getting out of that window of treatment opportunity. Have you seen some of that with surgery patients with surgical emergencies, appendectomies and the like, that people have delayed care too much?
Absolutely, yes. And it certainly is understandable as far as people wanting to try to avoid coming out. And I will get to that, I'm sure, in a little bit. I think that also has now changed. But yes, we definitely saw that. And for some things, of course, if you delay care, why, you can get away with that. But some of the things, it makes things much, much worse. And certainly in my world, as far as some of the emergent surgeries, yes, we definitely saw that, where understandably people were wanting to delay or hoping their symptoms would get better. And then, of course, when they didn't, yes, we saw lots of examples, and we deal with some of the intestines that have a hole in them or perforated. And those kinds of things are true emergencies. And yes, we saw lots of people that delayed coming out, and inevitably that makes things much, much worse for the person as far as really their recovery, as far as how involved it is and how long it is, and even the chance they don't recover. So Yeah, we saw a lot of that, and we're still seeing some, a little bit less so, and it was clearly very detrimental as far as for the patients by delaying, but and understandable why some of them did. But yeah, so we saw a lot of that, and it was very problematic.
So when patients were in the hospital, and maybe even now still, do they express concerns about, am I going to get COVID in the hospital, or how do you talk about that with them?
Yes, and in fact, I bring it up typically because I feel that, understandably, even if people don't ask me, they're probably wondering, and in my opinion, they should be wondering. I think that's appropriate, and so yes, I always bring that up. And the I don't know about you guys, but I personally I feel safer in the hospital than I do out the grocery store or the other stores, only because to get in, everyone is screened with temperatures, symptoms, and they have to wear a mask. And so but yes, and some of our office visits we now do remotely via the televideos, which are very nice, or the people I see in the office. But yes, I always bring that up as far as, okay, what are the dangers of either coming to the office or going to the operating room, and then go through the things that we are doing, not as a salesman, but just to try to be very upfront of kind of my opinion about where things are right now and what they should be worried about, and allay some of the fears of things that I don't think they need to worry about at this.
Well, you mentioned the screening and so forth that's done at the doors, and everyone wears masks in the hospitals. I think I have wondered sometimes, and I don't know if you've had this impression, that sometimes that may have given the impression that the hospital's a dangerous place. Everybody that goes in there has to take all these precautions. So the hospital's dangerous, which is actually the opposite. And I think what the analogy I like to use is the reason why an operating room is safe for me to have surgery in it is because they control the air system. They control who goes in and under what conditions, what they're wearing, making sure that they're masked. They create an environment that's safe for me to get taken care of. And that's kind of the same thing that we're doing with the hospital as a whole. We're essentially creating a clean environment. And that goes to what you said before about how you feel safer in that environment than you do in other daily environments. Do you think that analogy is apt, or do you explain it in any different ways?
Yeah, no, I agree completely, Dr. Huth. I think that's right. And the operating room is obviously a very controlled environment for obvious reasons. But yes, and so with something like this, it further helps that. And I think you're right. I think that, I mean, understandably, people think hospital, okay, there's sick people there, and I understand that. And then, yes, when you're forced to do these precautions as far as temperatures and masks, yeah, absolutely, that would give the sense that, oh boy, there's something bad here. But yeah, I agree completely as far as I wish that that was being done everywhere, but of course it's not for various reasons. But the operating room itself, obviously, it's a very clean and sterile environment, and the standards that we use routinely as far as hygiene are way beyond, of course, most parts of the society that we're in. And so that has continued. And then there are a few other things that we do specifically in the operating room as a result of COVID, and it's really as much to protect the patients as it is the staff in the operating room. And one of the things now that is being done is now before elective surgeries or scheduled surgeries, every patient is tested, and that can be perceived as that's to protect us, but it really isn't. It really is to protect the patients, just to avoid, if somebody did have COVID, they tested positive, but they hadn't yet developed symptoms and they were going to in the next week or so. Obviously, it would be better to know that, such that we can then delay that surgery. So yes, now every patient before their elective surgeries, they are tested for COVID, and it's a 3-day or so turnaround, and then they're asked to self-quarantine between the time of their test and their surgery. And that just really decreases the chance that somebody with COVID that didn't know that yet would be having a scheduled operation. And then it also adds another layer of protection as far as the family that's bringing them and or the operating room itself. But one thing that I think has been very valuable, and it's been hard for patients, and I understand, and I feel bad about that, we have also restricted the number of family that can be with somebody. And certainly surgery, understandably, is a very, very anxiety-producing event. And understandably, people want their family with them. But really, we have continued to limit to one family member as far as with the patients for surgeries. If it's a situation where there's a caregiver that's needed to help somebody that has some limitations, then we can make an exception. But that understandably, it's been hard for patients, but to me, that's very valuable as far as, again, just to minimize the exposure of the people. It creates kind of an awkward situation. Patients are basically have to pick their one family member they want to bring with them, and I certainly stay out of that conversation. But to me, that's been a helpful thing, and that'll lift at some point, but it hasn't yet, and I think that's appropriate to keep that in place.
Well, I think you made an important point about how testing patients prior to planned procedures is kind of important for the patient, because the last thing I want to do is, if I'm having an operation, is in the post-operative period when I'm trying to recover from that, then to come down with the symptoms of COVID. That would be a disaster, and we want to avoid that for everybody. So that's an important point. And you mentioned some of the other things that we're doing with protecting the environment, but it's also true that a lot of the practices have, on the outpatient side, have put safeguards into place about patients coming in and sort of registering online or virtually. Are you doing some of that in your practice, or what's changed in your office practice as a result of the safeguards you're putting into place?
Yeah, several things as far as, and I think some of them have been perceived as inconvenient, but I think people are getting around that. And yes, there's several things that we do. Some of the appointments we can do via video chats using different platforms, and those have worked out reasonably well, even for people that don't want to do a lot with electronics or that kind of a thing. Most of the people, we can still use some that are very simple to use. For surgery, some of the appointments, that works okay. Some, just by the nature of what we do as surgeons, we have to examine the person and see them in person. But so when we can, we use some of the remote visits. But then, yes, the people that we are bringing into the office and need to, several things have been done. I think one of the nicest things really has been now the registration that would have traditionally been done at the front desk of a doctor's office. That now we do also by telephone, actually, and while the patients are still in their cars. And then we don't bring anybody in until their room is ready, their exam room, and we obviously decontaminate the exam rooms between each patient just in case. So our flow, once all the registration that traditionally would have been done at the clipboard at the front window, that's now done over the phone, and then our staff calls the patient in their car, hey, we're ready, come on in, and that way they just go straight through the waiting room and then back to their private exam room. We essentially don't use a waiting room anymore. And then the same, of course, we all wear masks and the staff wears masks. And then once we're done, as far as the office appointment, we also do all of the whatever scheduling is needed as far as tests or surgery. That is all done with the patient still in their private exam room, and nobody, again, comes back out to the front desk or the window, that kind of a thing. And so when we're done with all of that, then they can go directly out of the office. So there really is essentially no contact between patients and other patients. It's only with the staff. And to me, that just makes a lot of sense. And I think it's comforting to the patients. Now, same thing in the office. They can bring a family member with them. I think that's important to hear the conversations we're having and the decisions we're working on making. But we limit the number of family. And I realize that that's hard for patients. But again, to me, that's very, very valuable and worthwhile. So it's been a change. It's for the
Tom, let me ask a final kind of two-part question, then we'll let you get back to work. Did you see how much did your workload diminish during this COVID epidemic. And then something I'm curious about as well, of elective surgeries that had to be delayed. Were many of those patients lost? I mean, did people decide to either delay or not have the elective surgery once they'd been put off the schedule?
Yeah, as far as the volume or our workload, about a fourth of our practice is urgent and emergent, and so that theoretically shouldn't have gone down any, but it did a little bit, back to the idea that the patients were not coming out even for those things until in a delayed manner when they couldn't go on any longer and then would come out. But yeah, our scheduled practice, we essentially stopped that, and that was, of course, in conjunction with the governor of the state of Indiana. And so that was probably 3/4 of our typical surgeries are scheduled, and those were stopped. And I think that was right. And then the follow-up, yes, as far as, so we, of course, had the patients that were scheduled before the COVID became more problematic, and then the office appointments that were scheduled. So it was easy to keep track of getting back in touch with those patients. However, understandably, there was a wide range of essentially willingness of those patients to come out, and ranging from patients that were very bothered that it had to be delayed at all and didn't really think that was necessary, to the other end of the spectrum. There are still some patients that still won't come out despite some of their conditions. Now that's a problem to wait longer, and so we try to explain, as far as, I don't know about you guys, I personally think things are going to be at this same level for a little while, and it certainly is time to do these things. But yeah, it was a big issue, and I never want to come off as being a salesman with a patient, but just very straightforward conversations of the dangers of waiting and the condition that they have getting worse. And even some of the cancer patients, we do a lot of cancer surgery, and some of those folks, understandably, they're still not willing to come out. And we try to explain that to them. And it's gotten a lot better as far as the people that'll come out. But some of the things that can truly wait if they want to, why, fine, and we go over that with them. But yeah, most of the people, it's been a real concern, and understandably. And I don't know about you guys, one of the things to me that's been very telling is, with the lifting of the restrictions nationally and all the other issues aside, the fact that by lifting those restrictions, there are some places, fortunately not here yet, the number of cases have gone up. And to me, that provides an irrefutable, these protections are helping. The idea of wearing a mask, and so people, that gets lifted and they go out in public and the numbers go up. Well, no matter what your thoughts are about this, that's a very clear demonstration that these measures that have been taken have been helping. And so it surprises me to still hear some people who think this is all unnecessary. And now that the cases are going up in some states, why, clearly this is valuable.
Well, those are good points. And Tom, we appreciate very much you taking the time to be on a Zoom call with us today. We'll let you get back to your busy activities and your busy day. And again, thanks very much. Talk to you later.
Thank you, Tom.
All right, thanks, guys. Goodbye now.
Thank you. We've got Dr. Wayne White standing by. He's in our Zoom waiting room, as it were, and we'll join him in just a second. Talk a little bit about what you just heard and how you see that changing. How do you, as medical professionals, begin to convince people that it is safe to go out, but that precautions have to be made? Do we need to get more people following masks? Do you think they need to see some of the numbers nationally coming down? Do we need to separate the national numbers from the local numbers a little bit more for people? How do you do that? Because as Dr. Grayson just said, it can be detrimental to people's health to continue waiting.
I think, as Dr. Grayson said, what's happening in other places should be a cautionary tale for us. We saw when we lifted these mitigating things that sheltering in place, and we people went out, we saw cases go up. So there's obviously a correlation. And it tells us that these things work. Wearing a mask, social distancing, hand hygiene, these things work. And we've got to convince the public and have them buy into this, that when we do these, there is an epidemic out there. We can't physically see the enemy. It's an invisible virus. But using precautions, socially distancing whenever we're inside around other people, and wearing a mask. Wearing a mask is such a simple thing, and it really shows you care about your fellow citizens.
And Dr. Grayson made a great point about how the events nationally and so forth provide pretty irrefutable evidence that the precautions help. And it's mind-boggling why some people still want to deny that. Now, I was asked last night on Channel 7, I should say Wednesday night on Channel 7, about the evidence for masking. And I always go back to a publication that was in the journal Science at the end of May, and we've talked about that here before. Mm-hmm. That's a good summary of the scientific evidence for masking. And if you put aside the fact that you can do filtration efficiency testing of all different types of masks, and cloth masks, homemade cloth masks don't have the same filtration effectiveness in a laboratory that a medical mask or a surgical mask does. That may be true, but it's also true that in practice we can see that even a cloth mask is amazingly efficient at reducing the emissions of infected droplets from somebody who has COVID-19 or any kind of virus. And it's amazingly effective for that. And then when you look at the epidemiologic characteristics of the disease, I always go back to tiny little Taiwan, an island in the China Sea off the coast of China. That little highly densely populated island has a higher population than the state of New York, but has 0.1% of the total cases and 0.02% of the deaths of New York. And they don't have lockdowns. All interventions are voluntary. But what they do have that's very different from the United States is they are a highly mask-wearing society. Everybody wears masks. And so to me what that says is we can all do more of our normal activities that we would like to do and reduce our chances of becoming ill if we would just wear masks consistently out in public. And I'm bothered by, I go to, at places out in the public and, people either aren't wearing masks or they're wearing them totally improperly. And, I don't understand that. To me, the evidence is very clear that masks in particular seem to have a lot of benefit that we're not taking advantage of.
You're watching Ask the Doctors on Whitewater Community Television's WGTV Channel 11. Our doctors, Dr. David Jetmore, Wayne County Health Officer, Dr. Thomas Huth, Reed Health. We have in our Zoom waiting room Dr. Wayne White, who is the Fayette County Health Officer. Dr. White, thank you very much for joining us today. Appreciate you taking some of your time to be part of our program.
Thank you for inviting me. I've never done one of these before, but I'll be glad to answer any questions you have. I was told by Tom that we kind of wanted an update of what's going on in Fayette County. And I say that probably everything's status quo. We've reached a plateau in our cases, and it's fairly quiet around the health department at this point. But as the previous speakers mentioned, probably going to get a little bit more active as people get out and about. In Fayette County, we've only had roughly 97 cases and maybe one in the last 2 weeks. So it's not a real hot spot at this point. And that is why a lot of people, I think, get a false sense of security. And I think the message needs to be that we need to stay vigilant, keep our masks on. I've got mine on. It's hard to talk. It's hard to breathe sometimes. But as Tom mentioned earlier, the article that he mentioned in the Journal of Science is very good at showing the evidence of the utility of masks. And I think we just need to make that the fashion statement of the summer.
Well, Wayne, we really appreciate you being here, and we especially wanted to talk to you because this program is also broadcast in the Fayette County area by a partner organization there. And so we want to make sure we got the sort of the voice of Fayette County into the broadcast. But it's also true that Fayette County has been on a little different trajectory than Wayne County on a sort of a per capita basis. You've had a few more cases and a few more deaths just on a sort of on a population adjusted basis. Why don't you go back to the beginning? When did you first notice that you were having cases, and what was that like in making that transition from pre-COVID thinking to, oh my gosh, we've got COVID-19 in this community now?
Well, I believe the first was around, it was probably in early March, and it was an elderly gentleman who arrived. Actually, he had expired on the way to the hospital, and he was tested in the ER and found to be positive for COVID, and became our first COVID death. And then they trickled in after that, and we had one case that of a younger gentleman who was well known in the community, and his sort of journey was well documented on Facebook, and everybody seemed to know about that. But after that, we generally just had patients that would end up from the respiratory clinic ending up in the ICU at Reed. The biggest problem was when a worker went to one of our local nursing homes with some symptoms and then was convinced to go get tested. But by that time, she'd infected 22 of 24 people in a memory unit. And out of that came 4 deaths. And so our numbers doubled and our deaths doubled overnight, sometime around late April. But and then, like, again, it's just now the case rate has sort of trickled in from then. Now, we at our health department it's not we answer most calls for these cases, and we're able to track and trace the cases. But the problem is that a lot of people we get a lot of pushback about the quarantining. We sort of relied on the state to help us emphasize the need to stay put. We have an employer yesterday who's one of their employees tested positive, and everybody in the facility went and got tested. The employer wants them all to come to work until their tests are negative. And we said, no, you stay put until we know the results. And luckily, Optum's being a little quicker on turnaround, but it's still a logistic problem. But basically, we're low numbers, and I try to reinforce flatten the fear curve as well as the regular curve. But I totally agree with the masks, and we really emphasize that, but we don't mandate it yet. I understand some communities are starting to pass ordinances for that, but so far not.
You mentioned a good-sized outbreak in a nursing facility. Have you had other hot spots in the county besides that particular nursing home?
That was the big one, and since then, like I say, they've sort of trickled in 1 or 2 a week cases, in the last 3 or 4 weeks. But
so a lot of counties have done exactly what the governor's restrictions required. Wayne County took a little bit stronger approach for a while, enacting additional restrictions. In Fayette County, did you all do anything in addition to the governor's restrictions?
Nothing in addition, but I have to admit the businesses were good sports about this, and they continue to comply with all the recommendations of the governor. And most businesses are practicing social distancing, and the employees are definitely wearing masks. And and I think as the numbers start to go up nationally, I think people are going to realize how important the mask is, and we're trying to get that message out.
So you mentioned employers being very helpful and so forth. How has the community in general responded to the direction of the governor and your health department in trying to keep everybody safe?
So far, so good. I mean, there's no real strong pushback. I mean, there's a lot of people, there's the half of the crowd thinks this is a hoax and the other half thinks it's the end of the world. And I think we're kind of in the middle of that group. And everybody looks at the news and we get in Fayette County, I have put 2 or 3 articles in the paper, but I'm not Dr. Fauci every day giving the Fayette County update like you folks have done. But I think the message is out there that this is a serious problem, but we still need to get our economy going. And there's a happy medium there somewhere we're trying to meet. Nobody seems to have all the answers, but I think we're trying the best we can.
Okay, good. Wanted to touch quickly on school reentry. How is that going? Are the Fayette County schools coming up with solid plans, and are you assisting in that?
Definitely. I've already spoken to the superintendent for over 30 minutes this morning, preparing for our board meeting tonight. And it's just, there's a lot of pushback from some of the teachers who feel that they're going to be at risk. And again, I told Scott Collins, I said, we need to convey a feeling of respect for this virus, but we don't need to be so fearful that, we can't get kids back to school. And you and I talked about the recent studies that show that kids are not super spreaders. And I'm hoping to convey that idea that we need to get the kids back to school. The repercussions of not going to school in person probably have more collateral damage than the virus itself. But they have used the state's their boilerplate guidelines for reopening schools and then amended it to our local level. We're going to have kids wearing masks if we can. We're going to encourage it but not mandate it on buses. They have spacing in all the classrooms. They have excellent opportunities for offline learning if a family is just adamant that their child not be exposed. They can get classroom credit online. So I'm not sure exactly all the details on that, but Scott is working that out. But as far as I know, we're starting school August 5th as usual. And we also have mandates for all the different sports, and they are up and running now, and practice social distancing, sanitizing, all that.
Well, good. Sounds like things are kind of getting back to normal a little bit. I wanted to touch as a last question on how helpful do you think the Optum testing site at the National Guard Armory there has been to the community and to you in helping to identify cases and helping to kind of spread the word that it's real, and how has that been accepted in the community?
It's funny. It's at the Armory, and everybody knows where that is. And but now, as things are starting to open up, and like I mentioned, the business that just had a case, everybody's hearing about the Optum site, and it should pick up. Now they've been doing roughly 25 to 30 tests a day. I bet it'll really pick up now. And it's so user friendly. I've gone there 4 times. I've been tested 4 times just for the fun of it, but basically because I'm around patients in the office, and I go about every 2 weeks. It takes 10 minutes door to door, and I tell people that. And they are looking for, you don't even really have to have an appointment now. You can walk in as long as you have your ID number and get the test. And the turnaround has been from 36 to 48 hours. I had the second test I got back the second day, but the others taken about 48 hours. And I just want to say, yes, it's very important. They're going to be there through July, and it gives people an opportunity to get back to work sooner, because most of the employers require 2 negative tests 24 hours apart, and that would be length of 4 days if you did the math. So rather than waiting 10 days.
Dr. White and Dr. Jetmore, both. You're talking about school reopening, you're talking about sports taking place, and the guidance that you're giving the superintendents. When you talk about sports, particularly those sports where people like to gather, football, how are you all guiding the superintendents, guiding the community? Because these are spectator sports. People want to go see their kids play. Stadiums only hold so many. It's still a very important night in the community. How are you talking to the superintendents about what they should expect, how they should work with the crowds, what mandates they need to put in place if people are coming? Do they need to wear masks? Talk about how you all are having those conversations right now.
Well, I told Scott that we need to offer masks to every spectator. They ought to be, 3 to 6 feet apart between families, and crowd at least 50% or less than they've had before.
How was that taken?
He's going to present it and see what happens. Nobody knows, I think as the health department, we need to just set guidelines and then let it fall where it may. But we can't have the same amount of crowd at a football game and not expect a big surge in cases if everybody's screaming and yelling. Dr.
Jetmore, what's the conversation? Well, have you all even moved to that sports conversation yet?
We haven't discussed these specific things with the school superintendents here. We've discussed many things, I can assure you of that, but we haven't, and there'll be more discussions. We haven't really dealt with the nuts and bolts of sports. I think it's intuitive that you're going to have to limit the crowds. They're going to have social distancing and masks. The athletes themselves obviously can't wear masks and can't social distance. That's the nature of sports. I think there's less danger with sports like baseball, where the competitors are distanced. You've got the bases and the outfield positions. And with soccer, it's played outdoors, you're passing by one another. Sports like basketball and football are much more problematic. We're trying to thread the needle here in terms of being as safe as we can, and yet not robbing our kids of the natural benefits of comradeship and the things that they get from sports. The myriad of things.
Totally agree.
But these are, I know you have, I've been in those same discussions, Wayne. The questions that the school comes up with are always difficult to answer. It's not like, well, that's simple, just do this.
Yeah.
Even the problem of transporting children on a school bus. I think we're going to need to even ask parents, a lot of parents, if they might not bring their children to school, to decrease the load on the buses and do everything. We've got to. You said earlier with Wayne, and I really agree with this. School is so important, not only to the children but to our society in general. Working parents need to have a place for their children to go. I think the school e-learning is a good thing, but I don't think that it measures up in any fashion to having, especially in the younger grades, of having a teacher teach these students. The whole social fabric of our society is dependent on these schools, and so I think we need to do everything we can to continue this and resume it in the fall. But some of these things, just the simple problem of having a lunch for the children. Obviously, you can't sit there with a mask on and try to eat. So, but there are things you can do. You can have all the children, all the students face the same way. If they're on a circular table, they can be 6 feet apart across the table. Will it be a perfect environment? No, it won't be. But we need to strive to come as close as we can to that, and because I think the benefits of education are so great.
Dr. White, we're going to let you go, but just before we do, talk for a minute about how much COVID and this virus is still controlling your office. Are you able to get back to some of the other work that public health officers are supposed to be doing and public health departments are supposed to be doing, or is this still consuming a larger part of your day than you want it to?
I think we're keeping up with the normal activities in the office. Even while I've been on this show this morning, there's been 3 people come up to get birth certificates, and all these things that we normally do are carrying on. Immunizations is a bit of a question, how much, only because some of the patients weren't allowed to come into the department during the shutdown, but we're catching up slowly on immunization rates. But generally, the office is running as normal. The COVID is not that overbearing. It's just we have to track down cases as they show up. So no, it's not affecting the day-to-day operation of our department at this point. And my office at my private practice and family practice, and it's back up to full speed right now. But we do all the things you do. Everybody wears masks, and we test everybody at the door, just like everything. And as Dr. Jetmore said, I think we need to get back to as normal operation as possible with the idea that we need to use common sense and simple things like just not coming to work when you're sick, and and make sure you wear a mask, and cough into your sleeve, and that kind of thing. All those, I think that's the best approach to stemming the spread and not overwhelming the system, which at this point I think we're in good shape.
Thank you for your time, Dr. Wayne White,
Okay.
Whitewater Valley Primary Care and Fayette County Health Officer. We thank you for being with us today. Hopefully we'll have you back on the program again.
Thank you, Wayne.
Okay,
Thanks, Wayne.
thanks.
Thank you.
Bye-bye.
You're watching Ask the Doctors on Whitewater Community Television's WGTV Channel 11. It is also seen on CTV3 in Connorsville, and thanks to John and his staff for being willing to do that. We had a couple of questions from last week's show. We always seem to kind of get some late. Let's see if we can get a couple of those in. We've probably got about 10 minutes or so left to go in our program, so let's see if we've got a couple of questions for the doctors to answer. I've been very disappointed in the number of people I've seen in public without face masks. Is there any way you can pressure our local leaders, city, county, and state to order people to wear face masks in public? We've kind of been having this discussion on and off today. I think your ability to order people is limited, but are you feeling a need to say what you need to say stronger, use stronger measures? Because you've talked about your disappointment too a little bit.
Yeah, along with this questioner, I feel disappointed as well when I go out into a store and I see not a single person working at the store or a single customer wearing masks. Having said that, if I were able to do that, I would mandate that people wear masks, which would make me instantly the most unpopular person in Wayne County.
Yeah.
And so I can understand those who have that power. They're reluctant to do so because the public, this has become such a lightning rod issue, and the public, there are some people, members of the public that are so resistant to the idea. They equate this with loss of freedom, not being treated as an American, their rights being trampled on, and it has nothing to do with that. It simply has to do with science and with one of the few ways we have of combating this virus in the middle of the 21st century's greatest pandemic. Yes, I'm disappointed as well. So the one thing we've tried to do is we've encouraged people, we've told people, we've asked people. We're trying to popularize the idea that wearing a mask is a very public-spirited thing to do, and you're making society safer for your fellow citizens.
To that, why don't you lead into what we got I got in an email this morning from Christine Stinson, Executive Director of the Health Department. I guess this came out of the state. Mask Up Hoosiers, I think we have one of these that we can put up on the screen just a little bit more. Is this from the State Department of Health?
Yes, it is. We're trying to talk up wearing masks and maybe change some of the negative ideas that people have about wearing masks. As Tom said earlier, we're not a mask-wearing society. And people who, mask-wearing societies, guess what? They have much lower rates of COVID than we do. So there's an obvious correlation, but you can kind of, I see Christine sent you this, you can write in who you're wearing a mask for. You could wear one for me, Eric. I'm an old person. You can.
Okay. All right. I'll put you in small letters over here.
Put me in small letters. I listed my mother, who's 96 years old, Ann Jetmore. I'll hold that up. I don't even know if that can be read. But anyhow, it says,
Yes.
Yep, it does. My mom, 96 years old. So there, I've got a reason to wear a mask. What about you, Tom?
I've got mine here. Again, it might be hard to read. Probably need to do it in black, very black, bold magic marker.
I got Al.
But I'm wearing for my friend Al, my neighbor Al, who also is 96, and is just an amazing guy who continues to take care of his own yard, walks his dog several times a day, and you would never guess he's that age, but he is. And I'm wearing my mask for him because I want him to stay healthy, and I don't want to ever be the source of him becoming sick.
We've got about 5 minutes left to go in the show. We're going to try to get, I think, one more question in before we go, since this is Ask the Doctors. Let's see what we can ask them, see if we got one more. Okay, it's going to take me 5 minutes to read this one. As younger children return to school, do I need to worry about my child sharing materials that can't easily be cleaned, such as books, puzzles, etc.? Do parents need to worry about sandboxes as a higher risk for transmission, as I know children will cough or sneeze into them, but teachers can't clean them? There's a thought. We're trying to separate fact from fear. Go.
Well, I think a lot of parents worry about sending their child off to school. They're going to be in a group setting, and I can tell you that there are many guidelines for this, and I think it'll give some peace of mind to parents. First of all, any material, there'll be a minimum of shared materials, if any, with students, and surfaces will be wiped down. This is the first time I've thought about sandboxes. Obviously, you cannot wipe down sand, but one of the things you have to remember is these virus particles don't last forever. So a simple thing by not using a sandbox over a 3-day period is going to eliminate any coronavirus that might have been in a sandbox. Other playground items like swings or slides, they can be wiped down and disinfected, and they will be. But I think the children will be in a pretty safe environment, and I think one of the things parents need to remind themselves is that children are unlikely to have any kind of serious infection from COVID. And as Dr. White pointed out earlier, and Tom has in the past, children are not the carriers that we thought they would be earlier. They are more likely and probably less likely to be carriers than adults. So, and the benefits of school for your child so much outweigh the risk that we should all be looking forward to fall.
No, I don't want summer to end. I'm not looking forward to fall. I don't want summer to end.
No, I didn't
yet.
mean it in that manner. I'll redact my statement.
Thank you. We're going to start to wind this one down. I'm going to give you each the 30 seconds or so to kind of wrap this one up today. If there's anything as we're heading into this 4th of July weekend that you want to say to the community, remind them of. Dr. Huth, I'll start with you.
Well, my advice to everybody is have fun, cook out, see some fireworks if you can, but we need to apply common sense principles. Number 1 is masking. Number 2 is distancing. Number 3 is hand hygiene particularly. I think if we do that and we avoid close congregations of people, we'll all be just fine. But it takes everybody to be serious about it, and that's what I'd like to see happen this weekend.
Dr. Jetmore.
Enjoy the summer and enjoy it in a safe manner. Mask, social distancing, hand hygiene. Go canoeing on the Whitewater River. I did that yesterday, Tom, and it was fantastic. And I was Morgan's canoe livery, and the people were wearing masks. Every other seat was used on the bus on the way back. You're on this beautiful river, and guess what? You're socially distanced because you're in a canoe. So enjoy this weekend, and be careful out there.
My daughter takes your advice. She likes to take her kayak out, so she likes to do that. Gentlemen, thank you very much. I hope you both have a very fun, very safe, very relaxing 4th of July weekend. We also want to thank Dr. Thomas Grayson and Dr. Wayne White for being with us. We've talked about schools on a couple of different occasions. We even had George Philhauer, the superintendent of Western Wayne Schools, with us. Next week, we're going to talk about higher education and what they are going to face. Kathy Girton, who is chancellor here at IU East, has agreed to be with us for the opening segment of next week's show, so we'll find out some of what the plans are for Indiana University East as they move into reopening and bringing students back to campus. I want to remind you that the free COVID testing site is still available. It is open Monday through Friday from 8 a.m. to 8 p.m., 601 East Main Street. You can do a walk-in. They do still ask that you register, lhi.care/COVID testing. Also, the Richmond Farmers Market is going to be open this weekend, so if you are looking for a place to go and grab something to make something really exciting this weekend, the Farmers Market is open. If you're still not comfortable going out to that, though, remember that you can shop online at the Richmond Farmers Market and be able to still get those great fruits and vegetables that you find there. There is something to be said about being out in the air, though. Thank you for watching this week's Ask the Doctors on Whitewater Community Television's WGTV Channel 11. We thank our doctors, Dr. Thomas Huth, Dr. David Jetmore. We'll see you again next week for another edition of Ask the Doctors on WCTV. As always, have a great weekend. I wish you well.